This is Dr. Dennis Locke, sports and regenerative medicine expert. Today we're going to talk about football players. Had a lot of football players over the years from both professional, collegiate, high school, and ex-football players. They're all different. When you have young football players, they don't have arthritis. If you have older NFL players, they've had many war injuries, and some of the linemen I've had at 26 look like they have 60-year-old knees. So they're all different. And one of the things that I stress is that this is personalized medicine. Just because you have a football player, they're not all treated the same, and just because you have stem cells, it's not all the same. So there's no one size fits all. This is personalized medicine. So you have to address each patient for what they have and then come up with a game plan for them. So we're going to talk about an ex-football player. I have quite a few. This is an interesting case. We get a lot of retired football players, and I had one lineman come in to me, and big guy, and I started getting into his history about college and won Division II college championship at North Dakota State. And I asked him, "Do you have a picture?" He goes, "No, I don't." I said, "You don't have a picture? You're the national champion?" And no. So Googled it, found it, came out. This picture here. I said, "Are you in there?" He said, "That's me right there, number 50. I was the team captain." And then there was an article we found all about him, and they interviewed him. He forgot all this exists. But it meant a lot to him that we got that, and now he has a picture of himself. But it was a very, very interesting story because this was a long time ago, and he didn't even have a memento of his playing days, but now he does. But as you get older into your 60s and you were a lineman, you get really banged up, and their arthritis gets accelerated. Typically they gain weight over 20-30 year period, which compounds it. So you add trauma, if they had knee surgery, and then you add weight. All these factors exacerbate the progression of knee osteoarthritis. So you take all that into account, and you have to come up with a specific game plan in addition to trying to treat the knee arthritis with the regenerative medicine and stem cells. So you formulate a game plan based on that particular patient, what they need, what their goals are. Obviously, they're not going to play football anymore, but they want to stay active, whether it's golf, walking the dog, functional, and you try to make them have the best quality of life. But everybody's different because there's different levels of arthritis involved, different ages, and whether or not they've had surgeries, whether it's multiple or not, all makes a difference when you're evaluating these patients. So there's a fine art to doing sports and regenerative medicine. So we're going to talk about this a little bit more.